at the National Nursing Forum in Hobart, and I have Luke here who will introduce himself.
Hello, my name is Yokota. I am a registered nurse and I live in Brisbane, Queensland, and I'm also currently the chair of the Men and Nursing Working Party for the Australian College of Nursing.
Fantastic. Now, you did a keynote presentation yesterday here about men in nursing, and you've launched an ebook. Can you talk about what your strategy is about and what role the book plays with that?
Oh, definitely. So this initiative started last year after the 2018 National Nursing Forum, where there was an address by the Federal Health Minister, the Honourable Greg Hunt, and I raised my hand, and the comment I made was very powerful and actually resonated very deeply with the crowd. From there, I was asked by the CEO of the ACN, which is Kylie Ward, to then form this working party.
What comment did you make?
So I'll paraphrase myself, but the comment was, if there is any young man or young boy who feels to do nursing and there's any barriers or perceptions why he can't, then we failed as a community.
Okay.
Yeah.
And why are those barriers there? What do you know about that, and what have you experienced?
Yeah, so the barriers have persisted historically, where nursing has predominantly been seen as a female profession. And just seeing men in a caring profession is not so normal. When speaking with many men, they are absolutely in love with their profession. And the capturing of the ebook, which was also launched yesterday, is capturing those stories and inspiring the public and people and absolutely men who would be interested in actually investing their life into a career of nursing.
Can you tell us some of those stories? What messages they get across about those barriers?
Yes, what I love about the ebook, it's so diverse. So it's actually men all across the country, from undergraduate all the way up to chief nursing officer, and they're very all intimate stories about their journey and also how they've overcome adversity, or they also share about how much they've had a positive experience. And you've got people from the bush, you've got people from major cities. It's really every flavour, and it's actually exceeded my expectations of how rounded it is and how it encompasses so many different perspectives and men. And I think anyone should read it because you'll get something out of it.
When you talk about barriers to men entering nursing, are they community values? Are they healthcare issues? All of the above?
Sure. So I want to be very clear that I do feel the majority of the community and families and friends support men in nursing. And some people can say that it can be possibly an outdated topic, but I definitely disagree with that, because what we're targeting is the undercurrents. It's the toxicity of masculinity and how that stereotype still plays out today. And those are the subtle undercurrents and, I guess, subconscious that a man may even sideline the idea of becoming a nurse. And what we want to do is actually make it really real what nursing is, and actually give them an equal opportunity to choose whether that's a profession for them or not.
And we do see it in healthcare then as well.
Yeah.
So I think it's less than 10% of nurses are male.
Just over. It's actually 11%.
Just got over?
We're creeping
Congratulations.
up.
Is there a target? What do you want to do?
Target. So the target is pending on our resources. So the Working Party through the ACN has submitted a grant proposal to the Federal Health Minister's office, and depending on the resources we have, we'll be able to predict actually achievable targets. In my speech, I was very clear that personally, target is not my end goal. My end goal is to actually make sure that there's any young man or boy anywhere in the country that actually wants to pursue it will actually pursue it. We don't want to have anyone who actually is not pursuing nursing because of these barriers and perceptions of men in nursing.
Fantastic. What are your takeaways from the conference so far?
Takeaways. It's not even
too
over
early.
Yet.
I know. Well, we're only 2/3.
Yeah, exactly.
Yeah.
Listen, there's been so many. During the conference, we've been doing men in nursing inspirational filming. So we're going to put together a short inspirational film, and just hearing those stories again from the pages of a book in real life. Oh, you should definitely watch out this space and see what that's producing.
Fantastic.
But in terms of the conference content, went to a co-current session about community health and telehealth, and the ways we're just looking, rather than doing band-aid solutions, actually looking at how can we help people actually make sustainable lifestyle choices which eases the overwhelming burden of chronic disease in this country. That was a very, very, I really enjoyed that presentation.
Fantastic. Thank you very much, Luke.
Thank you.